Hello, my name is Sierra, and today I will be talking to you about schizoaffective disorder. There are two types of schizoaffective disorder. One is the bipolar type, and the other is the depressive type, but both types include some symptoms of schizophrenia. The bipolar type includes mania and at times major depression, and the depressive type only includes major depressive episodes. Schizoaffective disorder may be unique to each person, but some signs or symptoms to look for include delusions, which is having false beliefs even though there is evidence to prove that it is wrong, hallucinations, which is hearing voices or seeing things that are often not there, impaired communication, unusual behavior, symptoms of depression such as feeling sad or worthless, periods of manic mood and acting out of character, problems with personal care such as hygiene, and impaired academic, social, or occupational functioning. An example of someone that may be struggling with schizoaffective disorder in real life would be someone who is usually very on task at their job and in school with their academics, very present in the moment, participating, social, and then they begin to start acting out of character. Maybe they are having a hard time staying on task. Maybe you notice that they're starting to really not take care of themselves. Maybe their grooming or hygiene, you notice, is a little out of character for them. That would be a sign that maybe this person is struggling with a schizoaffective disorder. Now, it doesn't necessarily mean that is what that person is struggling with, but signs such as poor grooming with someone who is usually very well groomed, falling behind in school, really off task, having a hard time communicating, being social, those would be signs to look for in someone with schizoaffective disorder. When untreated, schizoaffective disorder may lead to problems functioning at work, school, or in social situations. People with schizoaffective disorder have an increased risk of suicide or suicidal attempts or thoughts, some social isolation, family and interpersonal conflicts, unemployment possibly, anxiety disorders, alcohol or other substance abuse problems, significant health problems, or even poverty and homelessness. Issues in these areas overall affect occupations and may cause loneliness or trouble holding a job. People with schizoaffective disorder might need help and support in their daily life. Occupational therapy can help them manage symptoms and improve their quality of life. Some occupational therapy treatment interventions include developing grooming and dressing routines to support hygiene and dress codes in their school or workplace. You can provide education on hygiene and identifying dress codes for work or school. After a plan is in place for a good hygiene and dressing routine, you can carry out the plan by going shopping and having the client choose appropriate clothing and hygiene items, and then practicing the education that was given. Another intervention is positive affirmations. This is an activity that can be done with the client to increase their self-esteem by acknowledging and accepting positive qualities about themselves. Affirmations can be a great way of developing or restoring self-esteem. This can help treat any feelings of worthlessness that the client might have. Many people that have schizoaffective disorder may feel alone in what they're going through. At times, they may get discouraged in thinking what they have is wrong or makes them different. People with Mental Illness Enrich Our Lives is an informational activity sheet that can be used in intervention to help the client see that mental illness is nothing to be ashamed about. The sheet provides data of famous people who have or have had some sort of serious mental illness that have enriched our lives. This can be a powerful tool for the clients in treatment. In Life Skills 4, there is an intervention called Coping with Schizophrenia, Coping with Major Depressive Disorder, and Coping with Bipolar. These 3 handouts can be used in treatment to increase the knowledge of the client, along with their family members or significant others. The handouts are full of facts, positive and negative symptoms, and places for the client to fill in their experiences to help them identify healthy environments and routines to make their day go smoother. The handouts also state that to be able to cope with a mental illness, it is important to understand the illness. I think that quote is very accurate and important to know when treating clients with mental illness. There is an activity in Life Skills 4 called Conversation Skills. This activity shows that effective conversation skills are very helpful. Many are afraid of feeling awkward when meeting new people. Being able to start up a good conversation eases the first encounter with someone. People with schizoaffective disorder may have some impaired communication. Using this tool in treatment can help them increase communication by improving conversation skills when they first meet people. The activity has a sheet that allows the client to choose appropriate ways to communicate. This will help them break down the steps in communication so they can have a good conversation with others. It also gives them a chance to reflect on what they do well and what they may need to improve. If you think someone you know has schizoaffective disorder, the best thing to do is first talk to them about your concerns, addressing signs or symptoms that you might notice, and kind of get a feel for what's going on. You can't force that person to seek professional help, but you can encourage them and really support them to help find a qualified doctor or a mental health professional to get them the help that they need. I hope that this video provided you with more knowledge on schizoaffective disorder and how it can be treated in occupational therapy. Mental health is extremely important, and occupational therapy has so much to offer in helping those with mental illness. Thank you.